Hello, my name is Miguel Costa. I have been a therapist for over 50 years, specializing in the treatment of elderly patients. This year I turned 77, but I still continue to see patients daily in the office, receiving patients at least once a day. Over many years, after tens of thousands of consultations, I came to a very important conclusion. Health is not something great, but the result of small habits. Especially with advancing age, where even a simple action in everyday life can become a matter of life and death. 3 months ago, a tragic incident marked me deeply. Elderly men whom I saw every day in the park were suddenly rushed to the hospital. The reason was invariably the same: a wrong move made right after the meal. One of them could not even feed himself anymore, others could not get out of the hospital bed. As a doctor, I was surprised to see that such a common action could have such serious consequences. But what hurt even more was realizing that this tragedy could have been avoided. It was enough for them to know a simple piece of information. And it is exactly this knowledge that I want to pass on to you today. This information can completely change your next 10 or even 20 years of life. So watch this video to the end and please share it with the seniors you know. Sometimes a simple gesture of care can save many lives. This is even more urgent for seniors living alone, as in an emergency situation, there is often no one around to help them. That night I lay down thinking, if only I had told them that before, everything could have been different. And this reflection never left my head. A doctor's 50 years of experience cannot remain locked within the walls of an office. That's why I'm here, sharing it with you. By keeping a simple 30-minute break after your meal, you can swap a hospital bed for walks in the park. The actions you take in those 30 minutes have a direct impact on your health and even your life. Now, I'm going to explain everything to you in detail. I had a patient, a lady named Helena Silva, 79 years old. She was always healthy, but she had a habit. After meals, she would lie on the couch to watch TV. "It's more comfortable for me," she said, as many elderly people do. She believed that lying down after eating was better for resting, and that really seemed to make sense. In my youth, this did not cause any problems, but as the years go by, our body changes. These changes are even more noticeable in the digestive system and cardiovascular system. Once, Donna Helena was rushed to the emergency room with a sharp pain in the chest and dizziness. His face was pale and cold sweat ran down his forehead. At first, we suspected a heart attack. However, upon closer examination, we discovered that it was severe acid reflux. The stomach acid rose to the esophagus, causing a strong irritation in the nerve endings near the heart, which generated symptoms similar to a heart attack. Fortunately, on that occasion, everything ended well and she was discharged. However, even after the episode, the symptoms often returned. Despite the medications, the burning and pain in her chest constantly tormented her. She told me, "Doctor, I eat healthily. I don't understand why I'm still feeling sick. I reduce the salt. I eat a lot of vegetables and fruits." It was then that I asked her, "What do you usually do right after eating?" And I explained, sometimes it doesn't matter so much what we eat, but what we do after eating. These days, most health advice is focused on the composition of food, vitamins, nutrients, but few people talk about the importance of what we do after a meal. And this is extremely important. After eating, about 25% of all the blood in the body goes to the digestive system. At this time, the flow of blood to the heart and brain decreases, and precisely these are the organs that most need a constant and stable supply. During these 30 minutes, the body is extremely vulnerable. And if during this period you do incorrect actions, it can generate an even greater drop in blood flow, severely damaging the heart and brain. That's why I always repeat to my patients, the 30 minutes after eating is more powerful than any medicine. This phrase alone has helped many to reduce the amount of medication and feel much better. Now, I share with you everything I have learned in 50 years of medical practice, books, and listening to thousands of patients. Information that is not even taught in medical schools. Universities focus on disease mechanics and drug therapy, but the true impact of small everyday habits only reveals itself after decades of clinical practice. So pay close attention to what I'm going to tell you now. This can save your health and your life. If you find this information useful, share it, like it, subscribe. This way, you help this message reach more people. Now, I'm going to tell you about 3 things that are absolutely forbidden to do right after eating. Just by avoiding these 3 mistakes, you can radically transform your health. As an antihypertensive or hypoglycemic agent, taking these medications immediately after eating can cause dangerous side effects such as dizziness, nausea, and in more severe cases, even fainting. In a Japanese hospital, it was reported that about 15% of falls among elderly patients over 70 years of age were associated with the intake of medications, especially when taken right after meals. I remember well the case of Mr. Antonio Ribeiro from the city of Houston. He has always been in great shape, active and independent, but one day after lunch, he took his blood pressure pills and suddenly lost consciousness. He fell to the ground and fractured his hip. The fracture required complex surgery on the joint, and after that, he could no longer lead an independent life, needing to move permanently to his children's house. It only takes one simple mistake for the entire life of an elderly person to change for the worse. Therefore, most medications are recommended to be taken 30 minutes before meals or 30 minutes after. The correct regimen depends on the specific type of medication. Therefore, it is extremely important that you consult your doctor or pharmacist, especially if you are taking several medications at the same time. Each may require a different schedule and an individualized approach. When it says on the package, take 30 minutes after a meal, this isn't just a suggestion, it's an important safety measure. Please do not ignore this guidance. And now, I want to tell you about healthy habits that are the opposite of the dangerous ones we just discussed. These are habits as important as avoiding harmful behavior. After all, true health is achieved when we not only avoid evil, but also constantly practice what is good. The first healthy habit: drink a glass of warm water about 10 minutes after a meal. Very cold water can generate a shock in the stomach, slowing down the action of digestive enzymes. On the other hand, warm water or water at room temperature facilitates digestion and soothes the stomach. But beware, drink in small sips, slowly. This helps to soften food and improve the flow of digestive juices. And most importantly, it prevents dehydration, which is extremely common in elderly people. With age, the perception of thirst decreases, and many do not even realize that the body is suffering from lack of fluids. Mr. Carlos Mendez, who lives in the city of Kazan, has suffered all his life with digestive problems. For 45 years, he took various medications, until he started drinking only a glass of warm water after meals. Result? The heartburn disappeared completely. He himself confessed to me, "How is it possible that I did not know this before? It's so simple and so effective." This is an especially important method for the elderly, whose digestion is no longer as active as it was in youth. In addition, when the body does not receive enough fluids, the blood becomes thicker, increasing the load on the heart and impairing brain function. Scientific studies show that even mild dehydration can reduce cognitive functions by up to 15%. The second healthy habit: 30 minutes after a meal, take a light walk. Attention, it is not immediately after eating, but after half an hour, and it does not have to be a brisk walk. It only takes 10 to 15 minutes of walking slowly. This is not a sports practice, it is simply a support for your digestion. Walking at a leisurely pace helps reduce blood sugar levels, activates the digestive system, and improves circulation to the heart and blood vessels. Mr. Roberto Almeida, also from the city of San Diego, adopted this habit. Every day, after meals, he would take a walk around the block, which took about 15 minutes. The results were simply incredible. He was able to reduce the dose of medications, lost 5 kilos, which helped control his diabetes, and surprisingly, he started to sleep much better. "At first, I felt very lazy," he said, "but now I can't live without it. If I don't go out for a walk after eating, it seems that something is missing." A simple, unhurried walk helps stabilize sugar levels, improves digestion, and even contributes to a good night's sleep. If possible, choose to walk outdoors. Natural light and clean air offer additional benefits. However, if it is too hot or too cold, a light walk indoors is also sufficient. Remember, those 30 minutes after a meal are more powerful than any medicine. If you do this correctly, you can even reduce the amount of medication and, above all, avoid hospital admissions. And now let's summarize everything very clearly. We talk about 3 actions that are absolutely forbidden to do after eating. 1. Washing the dishes, cleaning, or any physical effort. 2. Lie down or lean back. 3. Take medication immediately after eating. These actions directly disrupt the digestive process and reduce blood flow to the heart and brain, which can have very dangerous consequences. And with advancing age, these risks increase as the body's ability to recover decreases. On the other hand, there are 2 actions that are mandatory after meals. 1. Drink a glass of warm water about 10 minutes after eating. 2. Take a slow walk, 10 to 15 minutes, starting 30 minutes after the meal. These 2 simple habits improve digestion, circulation, and overall health. In addition, right after eating, the best posture is to sit with your back straight, slightly leaning forward. This is not just a matter of etiquette or elegance, but rather a position that provides an anatomically ideal condition for the functioning of the internal organs, especially the stomach. Where to start? Start with the simplest. Maybe it's worth it right now to give up the habit of going to bed after eating, or to simply postpone washing the dishes for half an hour. As a doctor, my advice is this: a small change in habit protects your health much more than you might think. My experience of more than 50 years in medical practice has taught me something very valuable. Health is not in expensive medicines or miracle solutions. It is in small but constant daily actions. Especially in old age, changing your lifestyle is infinitely more effective than relying solely on pills. Medicines relieve symptoms, but they do not eliminate the cause. Research conducted at one of Moscow's university hospitals showed that among a group of elderly people over the age of 65, those who strictly followed the 30-minute protocol after meals showed a 47% reduction in digestive problems compared to those who ignored this recommendation. These are not just numbers, they are lives, they are destinies, they are stories of real people. If this information can save at least one life, then it was worth it. So please share. Spread the word about this to your family, neighbors, and friends, especially those who live alone and don't always get help in time. To date, most health advice has focused only on what to eat and what to drink. But, as you learned here, it's just as important as knowing what to do after eating. Only when you look at both aspects, diet and behavior, can you truly preserve your health for much longer. In the next issue, I'll tell you how elderly people who live alone should act in emergency situations after eating. What to do in case of sudden chest pain, dizziness, when to call an ambulance, and how not to waste precious minutes. This will be extremely valuable information which can save lives. So be sure to watch this video as soon as it comes out. And if you subscribe to the channel and leave your like, you will be helping us to take this knowledge to as many people as possible. Thank you so much for watching this far. From the heart, I wish you a lot of health, peace, well-being, and long days full of vitality. May this knowledge not be just something you have heard, but a seed that, as of today, begins to transform your life. Remember, health is not in magic formulas nor in expensive medicines. It dwells in the small but powerful actions of everyday life. And now you know that even what you do after eating can determine not only how you live, but also how long you will live with quality, autonomy, and dignity. Therefore, I ask you from the heart, share this video with your family, neighbors, friends, especially with those who are over 60, with those who live alone, or with those you love and want to see well. Subscribe to the channel, because here you will find content that does not arrive in quick consultations, nor in medicine manuals. Here it is real knowledge from those who have lived more than 50 years taking care of the health of people like you. And don't forget to leave your like, because that's what helps this video reach even more people. You can be sure that by doing so, you're not just clicking a button. You're being part of a chain of love, care, and health. You are literally saving lives. And get ready, because in the next video, I'll reveal what to do in emergency situations after meals, how to act in the face of sudden chest pain, dizziness, malaise, and how not to lose the most precious minutes of your life. Information that can indeed make the difference between life and death. So activate the bell, don't miss it at all, and see you in the next video. Take care, stay well. May God bless you. Thank you very much.